that with Niall Dickson, who's Chief Executive of the NHS Confederation, which represents organisations across the healthcare sector. Good morning to you.
Good morning.
Good morning. This plan, a 10-year plan, longest plan we've had, or previously 5-year plans, not perhaps getting the long-term planning in process. We've got long-term, we've got extra money coming in. How are you actually going to save those extra 500,000 lives?
Well, I think the plan will set out a range of promises from, reducing stillbirth, faster cancer treatment, better treatment for people with learning disabilities, and a lot more investment in mental health. I think the question that has to be asked of the government, though, is we need to be very careful we're not over-promising here. The fact is we are moving into a new era. We've had 10 years of very severe austerity on the health service, the lowest levels of funding year after year after year that we've ever seen. But we're going back to pretty much, or even a little below, the run rate that the health service was used to in its first 50 years. So we shouldn't be expecting miracles, and we should be absolutely recognising that this will be very tough. We've got a big workforce crisis. We've so far got no extra money announced for social care of any significance that would tackle the problems there. And there's no doubt that the ageing population will be, really challenging over this next period. So there are opportunities here. It should be better than it has been over the last 10 years. But I think both the public and certainly the politicians need to be aware, and actually they need to be saying that this is going to be a difficult era, a challenging era. Of course, expect the NHS to deliver on certain things that the politicians and the public want us to deliver on, but let's be realistic.
Well, this is it, isn't it? Although there's going to be an extra £20 billion a year by 2023, that just effectively is an increase that goes back to the previous typical average funding increase levels year on year. It isn't actually an extra huge big boost over and above that. It just takes us back to where we were before 2010. When we look at our comparisons with other Western European countries, the most obvious countries to compare ourselves with, are we massively underfunded? Are we roughly equally funded or overfunded per patient?
Well, I think we're underfunded compared with countries like France and Germany, but we are ahead of some other Western countries. I think overall, the study that we did last year, commissioned from the Institute for Fiscal Studies, made it clear that if you want the NHS to start transforming, and if you want to put proper investment in, you really need to put in 4% more every year for the next 10 years on top of inflation into the health service to meet the demands of an ageing population, rising expectations and new technology and the like. The government is promising something like 3.4%. There are ways of looking at that and saying it's actually a bit less than that if you take into account the fact they're not covering some things like training and public health within that. So I think the answer is it is better than we've certainly had over the last 10 years or so. It is also good, as you alluded to at the beginning, that we've at least got some degree of certainty over the next 5 to 10 years, as far as you can be with the current political situation. But actually some stability around funding will help, I think, the health service and local services to plan effectively.
Is it all about the money? I mean, family members of mine who've been in hospital in the last couple of years have just talked about just absolute ineptitude in terms of some of the administration, turning up to a cataract operation, 2 different operations, obviously, in different eyes at different weeks, and on each occasion, other patients who'd been booked in not being able to have their operations because the paperwork hadn't arrived. And this was, when this was discussed with the manager of the department, this was apparently completely normal and typical. Now, there's a lot of talk about, the NHS being the largest purchaser of fax machines in the world and of pages. Is there also an element where sometimes the NHS really isn't fit for purpose and is this overwhelmed, huge bureaucracy, and it's just not up to date with the 21st century and how people, for want of a better word, operate?
Well, lots of elements to that. So first of all, it's not over-bureaucratic or over-managed if you look at it and compare it with other countries. In fact, it's one of the most efficient services in those terms. That said, I think we'd have to admit that the health service has not been great at embracing technology. I think that is sometimes a public sector problem, because when things go wrong, then people sort of retreat back into old systems. Because it's such a big system, trying to join it up has proved very difficult. All the attempts to try and create a national system have not proved successful. I think the way forward on technology is we are now going to get it right. I sincerely hope so. And certainly the era of fax machines has to end, and has to end pretty quickly. As far as your example of somebody going in for a cataract operation, I would say for every one of those stories, and I hear lots of them, I also hear, as I did over the Christmas period, at least 5 or 6 stories of how utterly exceptional the care and the speed of the treatment and how well it's gone. So the health service is so vast and so big that you'll always have bad stories and good ones. So in answer to your question, I think there are examples, and that's a good example actually, where information is not following the patient, and we have to move, and I'm sure that will appear in the plan. We have to move to a situation where everything is digitized, where your information follows you wherever you go, where appointments are properly, and you're signalled and you're warned, people don't turn up for appointments and all the rest of it. There are much better ways, once you get onto a digital world, of managing this process more effectively and joining up services between GP services and local community services, between them and hospitals and social care. Those bits have not been done effectively in the past, and that is going to be a really big challenge going forward.
Indeed. Well, you mentioned social care again then, and it is extraordinary, I think, to most people, given how much all of the experts have been saying for years, and politicians who've been involved in this, that social care is the key issue. It's the Cinderella service that needs to be tackled. But a huge number of the beds, I mean, vast majority of the beds occupied in hospitals are those over 65s. Many of those will be needing social care. If better social care would often prevent them having to go into hospital, and certainly better social care availability would mean they could leave hospital sooner and free up those beds. Do you think this is a bit of an abject failure of a 10-year plan not to tackle the issue of funding for social care?
I think it is a failure that this government, and I have to say previous governments, have not dealt with the social care issue, and we're now running out of road, frankly, and this plan will not work unless we have a social care settlement and we have some kind of parity of esteem between social care and the health service. You ask people in the health service now, which never used to happen. People who are running, big hospitals will say, if there's any more money now to come into the system, for goodness sake, put it into social care. Let's try and join up these services properly. And so the government is promising again that it's going to produce another consultation paper. The key point for us is we need to get extra money into social care, and we need to do that now over the next couple of years, as well as sorting out the long-term funding issue. But we absolutely need to get additional funding into social care, and we need it urgently.
OK, thank you very much for joining us. Chief Executive of the NHS Confederation, Niall